Hi guys, today we're going to talk about 10 tips a gynecologist can give you when you are trying for pregnancy. Now, trying for pregnancy, it's a very exciting time, but also kind of anxiety provoking. People, when they start trying for pregnancy, as soon as they start trying, they want to get pregnant. That doesn't happen, right? It may happen in some people, but not for everybody. And what happens when you don't get pregnant, then you get sad, you get depressed, and that itself can affect your ovulation and chances of getting pregnant. So enjoy the ride. Don't get depressed about it. As soon as you start trying for pregnancy, doesn't mean you're gonna get pregnant. There is a research out there which shows that 80% people get pregnant at the end of 1 year, and 90% people get pregnant at the end of 2 years. So infertility is only 10%. So chances are 90% of the time you are gonna get pregnant on your own. Now, when you're trying for pregnancy, there are a few things I tell my patients when I see them for preconceptional counseling. They should be a little bit mindful of, not to make it complicated, but just be mindful of. So number one is healthy lifestyle and healthy diet and exercise. Now, there is not a particular diet it's recommended. It's just like a Mediterranean diet, which is high in fruits and vegetables and healthy serving of the protein. It's what you're supposed to follow. Do some exercise doesn't have to be any particular exercise. It could be cardio, it could be strength training, it could be anything, 30 minutes a day. The whole goal of good amount of exercise and a healthy diet is to maintain your BMI within normal range. So what is the normal range of BMI? Is about 18 to 24. So people who are underweight, they're below 18 BMI, or people who are overweight, above 24 BMI, have slightly increased risk of not only being able to get pregnant, but also of miscarriages, as well as pregnancy complications. So maintain that when you're trying for pregnancy. That was number one. Number two, you should be taking multivitamins. Now, most of the prenatal vitamins are over the counter. There's not a special kind I recommend, but when you're looking at the prenatal or a multivitamin, two things you need to be aware of. Take the one with the folic acid in it, and you need 400 micrograms of folic acid a day. What folic acid does is that it decreases the risk of miscarriages, and it prevents something called neural tube defects, which can cause miscarriages in abnormality in the baby. And the other thing you need to look for is something called DHA. DHA is good for baby's brain development. Again, most of the prenatal has it. Whichever one you kind of want, go for it. If you like the chewable kind, a lot of them don't have iron in it. So remember, if you need iron, if you're deficient in iron, then you have to make sure you're getting it on the side as well. Number three, you have to make sure that you restrict your caffeine intake. Now, recommended dosage of caffeine per day is about 250 milligrams of caffeine a day, which is up to 1 to 2 cups of coffee a day. Or if you are a pop drinker, then maybe one serving of the pop, or one pop, one coffee, whatever combination. But find out how much caffeine is in those products, as well as find out different kind of coffee places have different amount of caffeine. Like Starbucks has a high amount of caffeine in their products. So read the label and make sure you are restricting your caffeine intake. Number three, which everybody knows, you should avoid smoking and alcohol. Now again, both these have been associated with infertility, miscarriages, as well as problems during pregnancy with the growth of the baby. Number four will be if you're on any kind of medications. then talk to your doctor first before you start trying for pregnancy, because there are certain medications like blood pressure medications, people who have epilepsy or seizures, those medication can affect the baby. So talk to them so your doctor can change your medication to a one which is safe during pregnancy. Number 5, we want to know if you have regular menstrual cycles or not. Now, regular menstrual cycles are the cycles which are between the cycle interval between 21 to 35 days, which is normal range. Less than 21 days or more than 35 days in between two menstrual cycles suggests there's going to be some kind of a problem with your ovulation. So if that's what the case is, I wouldn't wait too long. I would go and see the doctor and see what can be done. Now, tracking the menstrual cycle is very easy nowadays. All these phones, smartphones have got all these apps available, which makes it really easy. But you can just use a piece of paper and a pen and just write it down. When was your first day of menstrual cycle? When was your last day of menstrual cycle? And when does your next cycle start as well? So number 6 will be tracking your ovulation. Now, tracking ovulation can be done in a different ways. Some people, they check their cervical mucus. Some do temperature charting. We call them basal body temperature charting. Those are kind of a little complicated. So to make it simple, I think you can use those commercially available ovulation kits, which are over the counter. What they do is that they will check a surge of a hormone called a LH hormone. This surge happens about 24 hours before ovulation happens. So it gives you an idea, number 1, are you ovulating? And number 2, if you are ovulating, when you are ovulating. So this brings me to my next point, which is, I guess it's gonna be number 7 now, right? Is fertility window. So what is a fertility window? Fertility window is a time about 6 days or so before ovulation. Now, what happens when you ovulate? The egg is only good for about 18 to 24 hours. And after that, if you have sex after that, it's useless. But the sperms, on the other hand, can stay in the vagina for up to 7 days. So when we calculate your fertility window, we calculate 6 days prior to ovulation. So that's the time when you're gonna have sex every other day. So we know there are sperms whenever you ovulate to help you get pregnant. So to calculate that, it's good to know your ovulation time. Again, don't stress out too much about this ovulation thing. Not everybody ovulates every month. So just because you didn't ovulate 1 month does not mean that's the end of the world. Just give it some time. Give it 2 or 3 months and see what's the pattern is. Okay? Then number 8 will be mindful of the lubricants you use during sex. Now, some of the lubricants like KY gel, and there are quite a few out, I don't want to name names, but there are quite a few out on the market which can affect the sperm's motility. The sperms are not going to be as fast and as motile when you use them. So when if you have to use a lubricant during sex, then use something called Precede, which is out on the market, or you can just use mineral oils or a coconut oil. That's totally fine, okay? But don't use the other lubricants because that can decrease your risk of getting pregnant. The number 9 will be it will be, there's not like a position which we recommend, okay, which is good for getting pregnant. Now, laying down or laying with your legs up in the air or all those things, they have not been shown to be more helpful than the other position. So you don't have to change what you are doing just to get pregnant. Studies have shown that after few minutes, literally few minutes of ejaculation, the sperms are present in the cervix as well as in fallopian tube. So you don't have to have a special position to get pregnant. So last but not least, you are not the only one, or your body or your story is not the only story which is going to affect you getting pregnant. It takes two people to get pregnant, right? You and your partner. So your partner also has to follow the healthy lifestyle, no alcohol, no smoking. If he's on any medication which can affect the sperm quality, quantity, as well as motility, he needs to talk to his doctor. If he has any surgeries done, especially like a hernia surgery or a testicular surgery or anything like that, that is a very important important information for us as a gynecologist to know. So if he is not in the best of the health, he needs to see the doctor too. So he's healthy, the sperms are going to be healthy, and it's going to increase your chances of getting pregnant. So pregnancy, as I said, it takes two. I don't want you guys to make it very mechanical and stressful situation. I would try on my own at least for 6 months. I told you 80% people get pregnant in a year, but at least 6 months before you start getting stressed out. Now, if you have any medical conditions, if you are not in the best of the health, if your age is more than 35 years old, or tracking your ovulation or menstruation, you figured it out that, oh, there is some kind of a problem, then see your gynecologist before even 6 months. So get an advice. This is actually is not a medical advice for you, because everybody's condition is different, everybody's story is different. So it's a good idea to see your gynecologist for preconceptional counseling, just to kind of touch base and make sure everything is in a right order before you start trying for pregnancy. So if you have a gynecologist, please contact them. If you don't have one and you want to come and see me, please contact me. My information is below. You can always message me on Instagram at GlamGyno. You can email us. My phone number is listed below, so please call us. If you like this video, give us a thumbs up, and if you have any questions, please write it down, so for the next video it will help me. Thank you and goodbye.